Let's learn more about HIPAA definitions. What is protected health information? Protected health information, or PHI, is any information which relates to either the past, present, or future physical, mental health, or condition of an individual. The privacy rule as it applies to PHI requires it to be maintained by a healthcare provider, health plan, employer, or healthcare clearinghouse. Exactly what information is classified as PHI? PHI includes any information found in the health record, such as encounters or visit documentations, lab results, appointment dates and times, invoices, radiology films and reports, history and physicals, and any client identifiers. Client identifiers include information by which the identity of a client can be determined with reasonable accuracy and speed directly or by reference to other publicly available information. Client identifiers include the following: license and certification numbers, vehicle identifiers, license plate numbers, serial numbers, Internet protocol addresses, health plan numbers, full-face photographic images and any comparable images, any dates related to an individual such as date of birth, or any other unique identifying number, characteristic, or code. Many DHHS clients have multiple service needs and receive services from more than one DHHS program and from outside providers. DHHS is committed to serve clients with multiple service needs in the most effective and efficient way possible. It is department policy for staff to work together and share information as necessary for service provision. What are uses? This is the review or use of PHI internally, such as for audits, training, customer service, or quality improvement. What are disclosures? This is when we release or provide PHI to someone such as an attorney, patient, or faxing records to another provider. Providing services and treatment includes sharing information to make referrals, determine eligibility, manage cases and coordinate services, and when needed for participation in a service integration team. In general, DHHS programs can share client information internally within DHHS for these treatment service purposes without client authorization. However, there are exceptions. For example, our staff who work in the school health rooms, as opposed to our school-based health centers, generally cannot share client information with other DHHS programs without written authorization. This is due to the fact that public school health room records belong to the school system and are protected by other laws that require an authorization. Client identifying information should be accessed and released only on a need-to-know basis. The need to know must be related to a legitimate work task. This means, for example, you cannot access client information just because you are curious about why someone you know is a client receiving services at DHHS. Accessing information out of curiosity constitutes an intentional breach with serious legal consequences and will result in significant disciplinary action, including possible dismissal. For requests from employees of Department of Health and Human Services, the following steps should be followed. 1. Identify each workforce member who needs to access PHI, and 2. Limit the PHI provided on a need-to-know basis. For requests received from individuals not employed at Department of Health and Human Services, limit the PHI provided to what is needed to accomplish the purpose for which the request was made. For example, when submitting a claim to the Finance Office for the purpose of obtaining a reimbursement for services rendered, include only client information required for the claim to be processed. The privacy rule regulates how healthcare providers use, share, and disclose personal information. The rule was not designed to create a barrier to healthcare delivery, but it permits providers to use, share, and disclose health information for the following purposes related to healthcare, such as treatments for clients, to obtain payment for services, and for healthcare operations. PHI used outside of TPO is not allowed without signed authorization. TPO must be within the minimum necessary for performing your job. HIPAA allows use and disclosure of PHI for treatment, which means providing care to clients, payment, for the provision of benefits and premium payments, healthcare operations, which includes normal business such as reporting, quality improvement, training, auditing, customer service and resolution of grievances, data collection, and eligibility checks and accreditation. In general, DHHS programs must obtain the client's written authorization to share client information with individuals or organizations outside of our department, although some exceptions do apply. Consult with your supervisor or the department's privacy official to determine whether your program has any special requirements related to sharing information for the purposes of treatment or service delivery. Our Notice of Privacy Practices explains to the client how we use and disclose their information to provide services. At the outset of services, use our notice to explain to clients that we are an integrated department and share information for service provision. This is particularly important for programs in which clients have a high expectation of privacy, such as behavioral health programs. Clients should know the limits of confidentiality before services begin.